Why has the idea of moving to the managed care become so popular?
In my humble opinion, fee-for-service doesn't work. That's where most of the fraud is occurring. It's in the fee-for-service component. If you look at Medicare at a national level, a lot of our Medicare recipients are now in managed care plans. And you see with the Medicare Advantage program that we have in Florida, and a lot of a big portion of our Medicaid recipients are in HMOs or managed care. I grew up in a managed care plan. Managed care has come a long way from the days of the beginning of HMOs, where they were the big bad HMOs and there was a lot of fraud and abuse in the system and people weren't able to access. But with a lot of the reforms that came down from Washington, we've seen them turn around, and actually they're a good component, a good partner in trying to help us manage the care for our Medicaid recipients. And it's not only the HMOs, we always also have the PSNs, the health management services systems. We have a lot of different components that we can use to make sure that people are actually accessing the system and having quality health care.
I guess a lot of people on the receiving end of Medicaid services, many of them are among the poorest of our citizens, are worried that all this talk about reform really means a lessening in the quality of service. And because when you reduce the cost of a service, a lot of people fear that means reducing the quality of the service. What is your response to that?
I think it's all the opposite. I think the whole goal that we have here with our chairman, Joe Negro, and our president, Harold Alpes, is ensuring that we increase the quality, increase the access. And number one is by the outcome measures that we're going to be measuring from our managed care participants. They want to make sure that they reach certain levels of quality, certain levels of health care, making sure that people are coming in, getting the preventative medicine. We're going to be grading these participants in managed care, and with the state, we're going to be grading them and making sure that they are accessing and giving the quality of services that we expect that they give. And we'll be grading them. And if they're not doing the service and not giving the quality job that they're going to be supposed to be giving, we're going to pull the plug and make sure someone else comes in and does the work. I don't think people should be worried about the quality of health care. I think we are very in tune with making sure that quality is part of the overall package.